Did you know that there's a phenomenon called beauty parlor stroke syndrome? What? Good news is it's a rare condition, but it's caused by prolonged hyperextension of the neck, like when you get your hair washed at the beauty salon. So let's talk about it. Yesterday, I presented the case of a 32-year-old woman who came to the emergency department after a visit to the hairdresser. She had been lying back in one of those salon bowls and she noticed some pretty severe pain on the right side of her neck, and she started to develop a headache. It was pretty uncomfortable, but she didn't want to mention anything to the hairdresser because she didn't want to bother her. She went home to sleep it off. When she woke up, it was even worse, so she went to the ER where she was given a migraine cocktail and sent home. The next day, her symptoms progressed where she felt dizzy and even a little bit of blurry vision, so she went back to the emergency department and a CTA was ordered. Doctor, what's a CTA? It's a test that we order when we think someone's having a stroke, where we inject contrast dye into the IV, and then that dye flows through the blood vessels, including the brain, and we can clearly visualize all the blood vessels in the head and neck. I've said it once, and I'll say it again. Neuroscience is cool. Here's one of the views that we can get on the CTA of the neck. And here you see that this white line right here is actually the vertebral artery as it courses through the spine. Here's a cartoon illustration of the vertebral artery. And what you have down here is what's called the subclavian artery, which is a branch of the aorta. And I know that you guys know what that is. We have the vertebral artery, which is a branch that runs up the side of your neck through your spine and then goes all the way up into to supply the brain. We also have two carotid arteries which come in the front of the neck, and here you can see the blood vessel supply of the brain, where these are the vertebral arteries that come up together to join to form what's called the basilar artery, and then these are the carotid arteries that also travel on the front part of your neck, travel through your skull base to join what's called right here the Circle of Willis. What you talking about, Willis? Don't leave me yet because this is really cool. Circle of Willis is a ring-shaped group of blood vessels that sit at the base of our brain. This is the way our brain was designed to hopefully help prevent a stroke. It's formed by a collection of three blood vessels. The basilar artery, which remember I said it starts as the two vertebral arteries, and then the two carotid arteries right here and right here. So basically what I'm saying is the carotid arteries, the vertebral arteries that all come into your brain, it forms a big circle to help deliver collateral blood flow. That basically means that if one of these has decreased blood flow, the other ones can help each other out because all the blood forms in a circle at the base of our brain. You can imagine that if you didn't have that Circle of Willis and blood flow in one of the arteries slows down a little bit, well, you could have a massive stroke. So this helps prevent that. Okay, enough of the jibber jabber. Let's get back to the case. Here we are looking at our 32-year-old CTA at the left vertebral artery, and these arrows are pointing to an area of decreased blood flow in our left vertebral artery. This is what a vertebral artery dissection looks like. Wait, where have I heard that term before? You've probably heard about it as it correlates to chiropractic manipulation of the neck. That's right, because any abrupt movement or trauma to the neck can cause a dissection. Car accidents, falls, whiplash, sports events, or going to the hair salon. Our blood vessels are basically little pipes that have blood running through them. And just like every other part of our body, they have their own anatomy with three different layers. In a vertebral artery dissection, what can happen is the innermost layer can experience a tear from the trauma. Basically, the innermost layer can tear off the middle layer, and then your blood will start to clot to try to heal it. Wait, so you can get a blood clot inside of a blood vessel? Yeah, so blood flow through that blood vessel will either be slowed down or completely occluded. Here is shown a complete occlusion with a vertebral artery dissection and a partial occlusion where you can still see that there's a little bit of flow around the tear. And that's what we're seeing on our patient's CTA, is that there is not a complete obstruction, but rather a significantly reduced amount of blood flow through her vertebral artery. Remember back at the beginning of our lecture when I was talking about this? If blood flow is reduced through one of our vertebral arteries, blood flow to the brain can also be reduced. Oh, that makes sense. Shows she's experiencing stroke-like symptoms because that flow through the vertebral artery has gone down. And luckily, like I said earlier, we have a circle of Willis that will help the rest of the brain with collateral blood flow in the event of the reduction through one blood vessel. But here's the issue. Blood clot is forming on the inside of this blood vessel, and part of this clot could potentially flick off and then go straight to the brain. And the first branch off the highway is a vessel off the vertebral artery called the posterior inferior cerebellar artery, also known as the PICA, P-I-C-A. And for you neuro nerds out there, a PICA stroke is also called Wallenberg syndrome or lateral medullary syndrome. PICA supplies a part of the cerebellum or the back part of our brain that controls balance, as well as the lateral part of the medulla or a component of the brainstem. So this MRI is showing a stroke of the PICA. So in patients with a vertebral artery dissection, we will want to get an MRI of the brain to ensure that they aren't having a stroke. Symptoms of a PICA stroke are what our patient was experiencing: trouble with her balance, trouble with her vision, headaches, nausea, and these symptoms may seem a little bit nonspecific. I mean, haven't all of you guys experienced headache and nausea at some point? And for you healthcare professionals out there, listen to your patients. They will tell you the diagnosis if you listen hard enough. All right, now that we've made the diagnosis, what the heck do we do? The good news is that our body usually heals most of these tears on their own. So what we really need to focus on with the treatment is preventing those clots from breaking off and going to the brain. So we give patients blood thinners. Here's what you need to keep in mind though, is that blood thinners do not break up existing blood clots. They just help prevent the formation of blood clots or for one blood clot to get bigger. So administering blood thinners will help prevent future strokes while her body is healing that tear in her blood vessel. And in some cases, we even will use a stent to help open up that blood vessel. And here you can see how that actually looks. And even coils can sometimes be placed into the false lumen to help prevent blood flow from going through that area and extending the dissection. So our patient was started immediately on a heparin drip to help thin her blood and then was started on an antiplatelet medication. That's a medicine like aspirin or Plavix. Typically, that's taken for 3 to 6 months while your blood vessel heals, and sometimes your doctor will then get a follow-up study to make sure that your blood vessel is patent and healed so you can stop treatment and resume your life. Luckily, in our patient, her stroke was extremely small and she completely recovered. She was on antiplatelet medication for 6 months. We did a confirmatory test to ensure that her blood vessel was patent and she went on to live a normal life. Now, this video is not meant to scare anyone from going to the hairdresser, but just explaining how things can sometimes happen. And if you experience a symptom, make sure you tell the other person. Your health is so important. Another case of patient-focused and compassionate care. Stay tuned next week and we'll go through another case. And happy 2025, everybody.